look at the doctor's strike. Dr. John Puntis joins me now, co-chair of Keep Our NHS Public and a retired consultant paediatrician. Good afternoon to you.
Good afternoon.
I was just saying at the opening of the programme, I don't know whether you heard, I was asking the question whether we think there is a deliberate attempt now to make the NHS almost unusable so that we're all much happier to pay a little bit or get an insurance policy to use the NHS. Is that a step too far from me to ask that question?
Well, I think in some ways it's a fair question, given the lack of investment in the NHS and in workforce planning. The service has undoubtedly been run down. Now, whether that's deliberately to move people to the private sector or not, I think is questionable, but certainly the NHS is very much neglected. And the consequences of that are the industrial action that we've seen from staff, including the junior doctors.
But there is no question, though, is it, that as waiting lists get longer, as more and more operations are cancelled, delayed, postponed, that people are taking matters into their own hands. I know people who've had to go for private scans, that they've had to go, if they want something elective like cataracts or knee surgery, that they've taken out a loan and done that because the idea of waiting, perhaps 2-3 years for that operation to take place is untenable.
Yes, I mean, there's good evidence that people are turning to the private sector, not usually so much through health insurance as to using money that they have or they can borrow themselves to pay for procedures to be done. Of course, the problem is that the private sector is entirely dependent on the NHS, and the people who work in it come from the NHS. So if they're doing stuff in the private sector, they're not doing work they could do for the NHS. So it's not a very sensible arrangement.
Let's turn to this strike. As I was saying again, it looks like it'll be 10 to 11 days that the NHS isn't running at full capacity. I mean, some would argue it isn't at any time because there are so many job vacancies within the NHS now. What kind of effect is this going to have on people in the next week or so?
Well, the main effect, I think, will be delayed outpatient appointments because the senior staff will be mobilised to stand in for juniors, and they would normally be in clinic seeing patients or in some cases doing day case procedures. I think it will be all hands to the pumps in terms of intensive care and looking after very sick patients. So it's people who are on waiting lists or who are waiting to be seen in clinic who are going to have these arrangements delayed for them, and that's clearly very regrettable.
It's up to 300,000 people they think will be affected by this.
It may well be. It was estimated, I think, 175,000 cancelled appointments in the last strike on 3 days. So that sounds a reasonable figure. But I think when we think about harm done to patients, it's important to note, I think, that in the last junior doctors' strike, there wasn't a significant increase in patient mortality. And actually the academic literature, such as it is, that's investigated the question of do more patients die during doctors' strikes, actually find that the evidence isn't really there. And I think that's because
everyone's cancelled. So, but you don't know. They may not have died in those strike days, but if you're cancelling appointments or cancelling screening or cancelling those things, you don't know whether that person has died 6 months later or a year later because of that strike. It's impossible to tell.
Yes, I would accept. I mean, you can't have a strike that does no damage, no harm. Otherwise, it's pointless. But I think that there are efforts always made to mitigate that, and I think that will happen this time. But I have to say, you need to compare the harm that's being done to patients through government policies in relation to the NHS. I mean, there's good evidence that 500 people die every week because of delays in A&E. 500 patients died because an ambulance didn't get to them in time last year. Over the last few years, 500 people have lost their sight because of delayed treatment on the NHS because it just doesn't have the capacity. And we have 7.2 million people on a waiting list. Many of those are suffering and some of those are dying. So I think it needs to be kept in proportion.
No, I completely accept that, but I am confused as to how a 35% pay rise will reduce those numbers. Because even if you suggest to me that it means that we can retain the doctors and we'll get more doctors, we still don't have enough and we're not training them up quick enough.
No, and it's symptomatic of a whole range of problems in the NHS. And it's not just the NHS, it's health services across Europe. So the World Health Organization has warned that there's an absolute crisis in terms of recruitment and staffing of health facilities, and that this is really putting society at risk. And the problems that the juniors have is that they are worn out. They've missed out on their training because of COVID. They were put in very difficult situations, for example, often not being given the right PPE. They've now seen this massive reduction in real terms spending power from their income over the last 15 years. And they're facing very high cost of living, as we all are. But, bear in mind, many of them are starting families. They have young children. They're sometimes paying £1,000 a month for childcare for one child. These are enormous amounts. Plus the fact that when you leave medical school, you have on average a debt of between £50,000 and £90,000. This is a huge amount. If you contrast it with my experience in the 70s, no fees, no debt, paid for accommodation, started work, I had no debts whatsoever. It's a very different situation. And this is about actually caring for the workforce and saying that we need to have well-staffed, safe environments, and we need more investment. We need more beds, and we need more staff. We need capital investment, which just isn't forthcoming. We're way behind other European countries in this respect. And Anita Charlesworth of the Health Foundation said recently, there is no route to a better NHS that is not an appropriately funded NHS.
But the likelihood is, they're asking for 35%, which a lot of people would see as an eye-watering rise. And also, the likelihood is if they get anywhere near that, which I would suggest would be unlikely, that will have to come out of budgets in the NHS. So the doctors will be going, well, we got our pay rise, but, there's less money in the NHS. Doesn't sound very caring towards the patients.
Well, it only has to come out of the existing NHS budget if the government make the decision to do that.
Which they have with the nurses.
Yes, and I think that's completely wrong and very damaging.
But where's it going to come from?
I think the 35%, well, I would say it could come from a wealth tax and doing something about making our taxation system fairer. But I think 35%, it's a negotiating figure. They're not making that a precondition for negotiations. They're saying, actually, we've lost 35%, so is it that unreasonable to ask for 35%? I think you can say it's very shocking that their pay has been eroded to this extent. And one of the things they want to discuss with Steve Barclay is, does he recognise this as a problem and what can be done to stop it happening again in the future?
Good to talk to you. Thank you very much indeed for